everyone, and welcome back to Talking Point. I'm Mayor Mike, and with me today is Laura Waldvogel from Family Health La Clinica. Welcome, Laura.
Thank you. Thank you for having me today.
So tell me a little bit about what La Clinica does.
So Family Health La Clinica is a community health center, also known as a federally qualified health center. We have been around since the early 70s, incorporated in 1973. We started as a migrant health center providing services to the migrant and seasonal egg workers in this region, and then transitioned to a full service community health center in the late 80s where we serve everyone. So it's medical, dental, behavioral health, WIC programming. The focus is for those who have difficulty accessing care, which in our rural areas is everyone.
Right. Right. So most people probably didn't know that the Family Health existed. Where are you located, and how can people find you?
Oh, that's a great question. So we have locations in 5 areas, and then we also have a mobile unit that travels the state, still serving the migrant and seasonal egg workers in the state of Wisconsin. Okay. So our locations are Wautoma, where we have medical, dental, behavioral health, including recovery services for substance use disorders and WIC programming. We have another location in Beaver Dam, which is dental only, Mauston, Wisconsin, which is dental only, Friendship, which is recovery and behavioral health services, and here in Stevens Point, we operate what used to be the Ministry Dental Center. Okay. And so we have a dental only location here in Stevens Point.
Okay, and you mentioned that you predominantly serve rural or migrant clients, but that's not exclusive, right?
Right, and it's not even predominantly. It is a special focus, and it has always been our special focus. It is how we began, and we are the only migrant health center in the state. Our locations are primarily rural. However, when we opened Stevens Point and Beaver Dam, that changed a bit. They're not huge metropolises, but they're certainly not rural like our locations in Wautoma, in Mauston, and Friendship. Okay.
So if well, let's just say I don't have insurance. I have a medical condition. My shoulder hurts.
Right.
I live in Stevens Point, but I don't have to visit the one at Stevens Point because that's predominantly dental, and we'll talk about that later.
Yeah.
But am I allowed to travel to another city to get your services?
Yes, you could travel to Wautoma. Anybody can access services. So it's we are designed to reduce barriers to those who have access issues, but we really are there for the entire community. So yeah, if you don't have insurance, you can visit our Wautoma location. When you make an appointment, when you come in for your first appointment, we will set you up with a financial navigator who will assess whether you may be eligible for some insurance benefits, and if not, if you're eligible for our sliding fee scale.
Okay. All right. So that this isn't a free clinic.
Correct.
But based on your income, and that's really important, especially with people being unemployed. I imagine it's huge with the migrant population, but also homeless people or maybe people who just can't afford health care.
Right.
You provide services for those people, meeting a need in the communities. So I really respect and appreciate that.
Oh,
and I'm
thank
sure
you.
lots of people do.
Thank you.
So let's talk a little bit more about your Stevens Point office. So you provide predominantly dental care here, but we are looking at expanding, and that's kind of how we connected.
Right.
Looking to expand services here in Stevens Point. But tell us about your Stevens Point office, what you do, what your typical clients are.
Yeah, so it is primarily dental. It's only dental right now, and so we have we forged a long-standing partnership with Ministry, the Ministry group, and then of course that transitioned to Ascension. And they had approached us asking, when they changed to Ascension, they had wanted to step away from the dental service line. And so we forged a partnership where they provided a donation, and we took on the operation of the dental center. So it is now a Family Health La Clinica site. We have full service dental there. So what used to be a Medicaid only, where they used to just accept Medicaid only. We now accept all uninsured, Medicaid, commercial insurance, et cetera. So it's your general dentistry, so cleanings, fillings, extractions, crowns, bridges, things of that nature, and available to those who have difficulty accessing dental services on a sliding fee scale. So, and the sliding fee scale is actually available to everyone, whether you have insurance or not. Sometimes there are very large deductibles.
Sure.
So the sliding fee scale is still available to everyone.
Well, that's great. So let's talk a little bit more about that before we delve into the importance of teeth care. The community health centers, like yours, are important. They're subsidized through the government, which allows that sliding fee scale. It allows you to service those who may have challenges in other areas. Tell me what's unique about those community health centers.
Yeah, that's a great question. So community health centers are designed to address access issues. So we, in addition to a sliding fee scale for those who are income eligible, so up to 200% of the federal poverty level, that's what the sliding fee scale is there for. We also are governed by a board of directors, 51% of whom must be patients of the health centers. So the patient impact is pretty key. And voice is pretty key to what we're delivering. There, an FQHC, federally qualified health center, that's a designation, and it does allow for grant funding and a different reimbursement model under Medicare and Medicaid.
Okay.
And then there are a number of criteria that we have to meet in order to maintain that designation, including the sliding fee scale, the governing board, financial controls, quality controls. There's just a slew of requirements that we must adhere to. And we must charge for our services. But we cannot charge, or we must use a nominal fee for those patients who are up to the 100% of the federal poverty level. So we have a nominal fee. It's $15. And on our mobile unit, it is up to 100% of the federal poverty level. We don't have a fee for those services.
Okay. So I got to admit, Laura, that sounds crazy complicated. An average person like myself would have no idea how to navigate this stuff. But you mentioned earlier that you have professionals on staff to help me do that. So my real concern is if I walk in with an issue, whether it's dental or health related, you have people that can help. Can you tell me a little bit about how they do that?
Yes, the complication should be squarely on our shoulders and should not be experienced or felt by anyone who's coming through our doors. So I'm really glad that you brought that up. When somebody comes in to receive care from us, we have navigators on staff. Their job is to remove barriers. Anything that might be a barrier that might impact your health outcome. Transportation, food security, so you don't have access to food or housing. Maybe you're experiencing a homelessness issue, or the insurance, access to prescription medication, things of that nature. That navigator, in addition to assessing for insurance and assessing the sliding fee, they are the resident experts on the community resources that can help you obtain a better health outcome or things that just might get in the way. So, but when you come in the door, you're not going to know about all these crazy requirements that we have to adhere to. You're just going to experience a typical kind of medical, dental, or behavioral health appointment with the added function of the navigator who's there to help you overcome barriers.
And that's really important. So I want to stress that again is if you have an issue, dental or health-wise, all you really have to worry about is showing up. And they're going to take care of you. I assume you let people know in advance that this procedure might cost $15 or this procedure might cost $45, $50, because that's important too, especially people who are on a very fixed income, to know that ahead of time before they agree to have the service, and I assume that's how you work.
Right, absolutely. We ensure that anybody that's coming to us understands. And if you are having a dental procedure, for example, there's a treatment plan that is completed, and you know ahead of time what your allocation of the cost is going to be. When they're more, like let's say crowns, bridges, dentures, things of that nature, the fees that are associated with that depend on your income and the lab fees associated with those procedures. But you know about that ahead of time.
Okay, and that's really important. Again, as I said, especially for people on the lower fixed incomes, 30, 40 bucks one way or the other could make the difference between eating today and not.
Yes, in behavioral health in particular, this comes into play, or people in recovery, where they tend to have more appointments. So the sliding fee is lower for that because they're repeated appointments.
Okay. With the pandemic, healthcare has been all over the board, lots of stress, tons of beds being filled to the capacity. How has the pandemic affected community healthcare?
Well, much like it has impacted everyone else, as well as how it impacted public health. We are expected to respond to community health needs. So if there's a tornado, if there's a public health emergency like a pandemic, we need to pivot and we need to respond. So in our case, that meant taking care of the community with, it feels like 10 years ago, but taking care of the community with risk mitigation strategies like, testing, and now it's vaccination. But we also serve that special population, so we stood up programming specifically for migrant and seasonal ag workers, their employers, and the communities in which they're living and working to keep them safe so that the food supply would not be impacted and they wouldn't be impacted.
So what sorts of challenges have you seen as it relates to the pandemic?
Yeah, so definite staffing impact, which is...
That's tough all over.
It is, and it's not improving. So what we saw last year were people getting ill and needing to be out because of COVID. And what we're seeing this year is just even more staffing shortages that definitely are impacting our ability to be at full volume. This is not unique to us. This is an issue, I would say, throughout the United States in healthcare and elsewhere.
Right.
So it's, and burnout, that's the other thing. People in healthcare and other professions just really tired and pretty significantly impacted with burnout.
Yeah, I can imagine, when you're short-staffed, the job still has to be done.
Correct.
So you rely more on the staff that you have, overtime, really long days.
Right.
And that wears you down after a while.
And it's not sustainable.
So, no, absolutely not.
So there has to be, there has to be modifications because it's just not sustainable. There is no way to think that we can continue at full volume when we don't have full staffing.
Oh, right. So, and I think most people are generally familiar with medical treatments.
Yeah.
I cut my finger, I broke my arm, I have this weird thing growing out of my leg. And I think they understand the services that you can provide in that regard. But, most people underestimate the importance of dental care because your teeth are really connected to the rest of your body. If you don't have a healthy mouth, you are going to have all sorts of other ailments. You get an infection or an abscess, that literally affects your whole body. Talk to me about the importance of dental care and some of the things that might be red flags for people. Maybe I don't know that I need dental care.
Yeah, it's you've named it. Dental care is essential. Access to dental care is critically important. It's important for our overall health and well-being, as you've mentioned. There are links to cardiac health and good oral health. And more than that, though, some of the access issues that we've seen have resulted in the inability to secure and maintain employment. Our appearance, not so much now maybe with masking, but before I'm a professional counselor counselor by training, and I can remember very well when I was in private practice serving folks that, one young woman in particular comes to mind. She had no teeth. She was in her early 20s, could not secure employment. And she was able to get hooked up with a community health center and remedy that with dentures, and then she was able to secure employment. There's just so many parts of this that come into play.
So it's not just the physical aspects of dental care, but it's the aesthetics as well.
Absolutely.
Unfortunately, people still judge a lot of people based on their appearance, and this is a big part of that. So.
Absolutely.
So I would encourage anybody that has any sort of issues concerning dentistry to visit you to see if there's something that you might be able to help with. Now let's talk about arguably one of the most important things you do, and that is related to substance recovery and behavioral medicine. Tell me about that and the importance and significance of that as it impacts the community.
Yes, absolutely. I think most of us have heard about the opioid epidemic. Even before that, though, there are issues, ongoing issues with alcohol abuse. In our state it's pretty prevalent, but it's also a nationwide issue, and just behavioral health overall. The pandemic has not alleviated or helped this. And as a matter of fact, it's made it much worse. More of us are impacted by mental health issues. And at a younger age, a lot of impact on our children. And so one of the wonderful things about community health centers, is that we respond to community needs in collaboration with other community partners. So the expansion into behavioral health occurred for us in 2016 or 2017 in response to recognized needs in our region. And just as why we're expanding in Stevens Point, there are recognized needs for primary care and behavioral health and recovery services here. That's what we did in the more rural areas that we've been serving for some time. So we were able to develop that programming by working with the Departments of Health and Human Services, other providers in the region, hospital systems, et cetera, in order to bring those services and start alleviating. Now, we haven't fixed this issue. We have issues with recruitment of mental health providers, just like the rest of the nation. There's a shortage of mental health providers. But not only is moving into the Stevens Point and Beaver Dam area needed because there are gaps in care, it's also easier to attract professionals to a little bit larger area that can then also service more of the rural areas.
Okay. And I talk about this frequently, that I believe mental health is the root of a fair amount of societal issues.
Absolutely.
Everything from substance abuse to domestic violence to depression and personality disorders. So it's really important that the people who choose to seek help have a place that they feel safe and comfortable with to try and get that help. But some of the problem is that I may not even realize that I'm borderline depression, or that mentally I'm not in a good place. And what are some of the things that people can use to identify some of their potential underlying mental health issues?
Yeah, a couple of things I want to say about that. First, I'll answer your question, and then if you don't mind, I'll kind of do a follow-up. Not enjoying things that you used to enjoy, just not feeling like leaving the house, not because of COVID, but just finding just more apathy, less energy. Some, of course, there are significant warning signs if you're thinking about harming yourself, or but that's more like prominent. You would be aware, but sometimes it's just you're just not feeling yourself anymore. And anxiety, just feelings of physical anxiety. Again, there are a number of things where you're just not feeling the way that you used to be feeling if you've not experienced it before. For us, Community Health Center, Family Health Clinica, the integrated approach to behavioral health. So if you're coming to see a dentist or you're coming to see a primary care provider, primary care in particular, screening for some of those things with those visits, and then getting somebody hooked up right away with one of the professionals on staff through a warm handoff, so that they can at least have a conversation, and then perhaps opening the door to more.
Okay. Well, so you talked about a mobile health center that you have.
Yes.
Tell me about that. Where do they visit? Are they on a regular schedule, and what services do they provide?
Yeah, so I'm very impressed with our mobile health team in particular, always. I mean, they've been at this for since the 70s. That's how we've delivered those services. But in the past year or two, really responding to the needs of the migrant seasonal farm workers in particular in this area and the state. So that mobile unit and our mobile teams, and even mobile teams without the mobile unit, have literally traveled the state. And if I had a map, I would show it to you, but there are dots literally throughout the state of where we have gone. Last year, we served over 3,000 of the estimated 6,000 migrant seasonal farm workers. And other states, migrant seasonal farm workers, there could be like thousands in one area. That's not how it rolls in Wisconsin. In Wisconsin, the largest population centers of where workers are a couple hundred. Okay. And they're scattered out all over. Apples, food processing plants, all the different crops that we're engaging in producing here. So we travel to those. We travel to the fields. We travel to migrant and seasonal housing units. We travel to employers like food processing and deliver those services, primary care. And in the past 2 years, it's been COVID risk mitigation, including vaccination and testing.
Okay. So in the mobile clinics, do you do dental work?
Yes. So we have not used that with our migrant and seasonal egg workers yet, because we have been very focused on COVID. However, in 2019, we purchased a new mobile unit that can do primary care, and it can also do dental. And we had started a program in Dalton, Wisconsin, which is in between Beaver Dam and Watoma, with the Amish community, providing dental services out of our mobile unit. And we will be resurrecting that, if you will, soon. The other thing that we do that I should have mentioned earlier is school-based dental. So we are in a number of counties, including Portage, delivering preventative dental to children in schools, including education, screenings, and sealant placement.
Interesting. You know, it's funny because that just triggered a memory when I was a kid, when in school, when they would show you how to maintain your teeth.
Yes.
They used to give you these pink pills that you would chew and swish around your mouth,
Mm-hmm.
and it would stick to all the plaque, and then
Yes.
you'd go brush your teeth and see how bad you were.
Yeah.
Is that still a thing?
That's still a thing.
It is still a thing.
Yeah.
Oh, wow. That's it's amazing. You would expect technology to have advanced a little bit through there.
Mm-hmm.
So more about the mobile unit. Is there a set schedule? How does someone find your mobile unit, or do you just know the certain hotspots and you make a loop? How does that work? We have done a lot of promotion. We have information on our website. We have done outreach to all of the small and large employers of migrant seasonal egg workers. And they reach out to us, we reach out to them, and we set up those clinics. Okay. Some of these we've just had long-standing relationships with for the primary care, and others, they're new relationships because they were significantly impacted by COVID. Okay. So is the mobile unit exclusively for those migrant farm workers?
No, it's for all. We have not, again, because of the past 2 years, we had just secured the unit, and then, we were pivoting and responding to this pandemic. Our intent is to use that mobile unit to do much more. So for example, when we're in the schools and we see a child who has restorative needs, like maybe needs some fillings, we would like to be able to take, if there are a number, we'd like to be able to take the mobile unit and set it up so that we can make transportation easier for for the parents of those children. We would like to expand the services to other areas where there are access issues. We just have not, the capacity due to the pandemic has not allowed us to do as much planning
Gotcha.
as we are intending on doing moving forward.
Yeah, and it's sad because we talked about this earlier, but pandemic has affected every single industry. Nobody is immune.
Right.
And some of the weirdest things that have happened because of the pandemic, maybe not directly, but indirectly.
Yep.
And this is one of those. I mean, access to health care should be universal.
Mm-hmm.
And what you do is very important, providing those services to the people that may not have other options.
Right.
Especially those migrant farm workers. They travel the country during
Yes.
different seasons. They don't have the stability of a home that they go to every night, and just so I really appreciate and
Yeah.
respect everything that Family Health Clinica does. One more time before we wrap things up,
Yeah.
give us the locations again, and then how can we get in touch with you? If I am interested in finding more about your services, social media, is there a
Yeah.
phone number, email, that sort of thing?
Our team has done an incredible job of upping our game in social media over the past couple of years. And so Facebook, LinkedIn, Twitter, we're on all of those venues under Family Health La Clinica. We also have a website, www.famhealth.com. And so all of our information is there. Our locations are here in Stevens Point. We have a dental location. I will say that capacity is an issue. The dental is in hot demand, and it might take a while to get in, but we are here, and that's why we're expanding. We're going to have a much larger dental program here and elsewhere. But Stevens Point, we are also in Wautoma, medical, dental, behavioral health, recovery, and WIC. We are in Friendship with behavioral health and recovery, Mauston with dental, and down in Beaver Dam, which is also slated for expansion, but currently dental only.
Great. And is there a phone number that we can call to see if there's availability or maybe schedule an appointment?
Yeah, 920-787-5514.
Okay.
So 920-787-5514, that's our main number, and then you would get directed to a different location if you're looking for Stevens Point or Beaver Dam or et cetera.
Great. Well, again, Laura, I want to thank you for joining us. Again, the services you provide are critical to a lot of people, and I'm proud to say you're part of our community.
Yeah.
If there was someone who wanted to help,
Mm-hmm.
I don't know if you have volunteer spots open, maybe just answering phones or things like that. How might somebody get in touch with someone to just let them know they want to help?
Yeah, I think the best approach would be to call that number that I indicated, or visit the website.
Okay.
There's a fillable form on the website where you can put forth your information. We often also recruit for members of the board, and we are also going to be looking for advisory committee members to help guide and advise us as we're expanding and as we're looking to really respond to community needs. So those kinds of things are, just so critically important, and if people have any interest whatsoever, we would invite them to call or to fill out that form.
That's great. And I know we've got plenty of active community members. Maybe they're retired from the healthcare
That'd be
field.
fabulous, yes.
And they just want to do something else, maybe to occupy their time or to further help the community. As you know, if there's anything that the city can do, and we've been working on trying to find a location that might allow you to expand,
Yes.
By all means, give us a call. But I hope that everybody here has learned a little bit more about the services that Family Health La Clinica does in our community and others, and to know that you have access to health care even if you don't have insurance or maybe you don't have a strong income. So I want to thank you, Laura Waldvogel, again from Family Health La Clinica. And until next time, I'm Mayor Mike, and we've been Talking Point.